Title: Hydroxychloroquine. Section: Summary. Hydroxychloroquine, sold under the brand name Plaquenil among others, is a medication used to prevent and treat malaria in areas where malaria remains sensitive to chloroquine. Other uses include treatment of rheumatoid arthritis, lupus, and porphyria cutanea tarda. It is also being studied as a treatment for coronavirus disease 2019. Severe side effects may include allergic reactions, vision problems, and heart problems. Common side effects include vomiting, headache, changes in vision, and muscle weakness. Although all risk cannot be excluded, it remains a treatment for rheumatic disease during pregnancy. Hydroxychloroquine was approved for medical use in the United States in 1955. It is on the World Health Organization's list of essential medicines, the safest and most effective medicines needed in a health system. In 2017, it was the 128th most commonly prescribed medication in the United States, with more than 5 million prescriptions. Section: Medical use. Hydroxychloroquine is used to treat systemic lupus erythematosus, rheumatic disorders like rheumatoid arthritis, porphyria cutanea tarda, and Q fever, and certain types of malaria. It is considered the first-line treatment for systemic lupus erythematosus. Certain types of malaria, resistant strains, and complicated cases require different or additional medication. It is widely used to treat primary SJA-Gren syndrome, but has not been shown to be effective. Hydroxychloroquine is widely used in the treatment of post-Lyme arthritis. It may have both an anti-spirochete activity and an anti-inflammatory activity, similar to the treatment of rheumatoid arthritis. Section: Research. Subsection: COVID-19. As of 3 April 2020, there is limited evidence to support the use of hydroxychloroquine for coronavirus disease 2019. Studies are ongoing with the benefits versus harms of treatment being unclear. While its use is not approved by the FDA for COVID-19 as of 7 April 2020, there is an emergency use authorization for such use. Some are also using it off-label for the disease. In April 2020, the U.S. National Institutes of Health began a trial to assess whether hydroxychloroquine is safe and effective to treat COVID-19. A small randomized trial in China of 30 patients did not show a demonstrable effect with hydroxychloroquine. This study, while negative given its small size, does mean that if hydroxychloroquine has an effect it is likely small, so a much larger study would be needed to show effect. The publication status of one non-randomized trial, which claimed hydroxychloroquine benefits for COVID-19, is ambiguous. The paper has been peer-reviewed and accepted by the journal IJAA. There is no note of editorial concern on the page as of 13 April 2020. However, on April 3, 2020, an official statement from the International Society of Antimicrobial Chemotherapy was issued. ISAC, in collaboration with the publisher Elsevier, produces the IJAA journal. This statement commences with the text. ISAC shares the concerns regarding the above article published recently in the International Journal of Antimicrobial Agents. The ISAC board believes the article does not meet the Society A Circumflex Euro-S expected standard, especially relating to the lack of better explanations of the inclusion criteria and the triage of patients to ensure patient safety. Additionally, on April 13, 2020, a joint ISAC and Elsevier statement was issued that included the following text. At present, additional independent peer review is ongoing to ascertain whether concerns about the research content of the paper have merit. Given this process of post-publication assessment is ongoing, it would be premature to comment at this time. The study authors have been contacted and asked to address the concerns. Section: Side effects. The most common adverse effects are a mild nausea and occasional stomach cramps with mild diarrhea. The most serious adverse effects affect the eye, with dose-related retinopathy as a concern even after hydroxychloroquine use is discontinued. For short-term treatment of acute malaria, adverse effects can include abdominal cramps, diarrhea, heart problems, reduced appetite, headache, nausea and vomiting. For prolonged treatment of lupus or rheumatoid arthritis, adverse effects include the acute symptoms, plus altered eye pigmentation, acne, anemia, bleaching of hair, blisters in mouth and eyes, blood disorders, convulsions, vision difficulties, diminished reflexes, emotional changes, excessive coloring of the skin, hearing loss, hives, itching, liver problems or liver failure, loss of hair, muscle paralysis, weakness or atrophy, nightmares, psoriasis, reading difficulties, tinnitus, skin inflammation and scaling, skin rash, vertigo, weight loss, and occasionally urinary incontinence. Hydroxychloroquine can worsen existing cases of both psoriasis and porphyria. Children may be especially vulnerable to developing adverse effects from hydroxychloroquine. Subsection: Eyes. One of the most serious side effects is retinopathy, which is generally associated with chronic use. People taking 400 mg of hydroxychloroquine or less per day generally have a negligible risk of macular toxicity, whereas the risk begins to go up when a person takes the medication over 5 years or has a cumulative dose of more than 1,000 grams. The daily safe maximum dose for eye toxicity can be computed from a person's height and weight. Macular toxicity is related to the total cumulative dose rather than the daily dose. Regular eye screening, even in the absence of visual symptoms, is recommended to begin when either of these risk factors occurs. Toxicity from hydroxychloroquine may be seen in two distinct areas of the eye, the cornea and the macula. The cornea may become affected by an innocuous cornea verticillata or vortex keratopathy and is characterized by whorl-like corneal epithelial deposits. These changes bear no relationship to dosage and are usually reversible on cessation of hydroxychloroquine. The macular changes are potentially serious. Advanced retinopathy is characterized by reduction of visual acuity and a bull's-eye macular lesion which is absent in early involvement. Section: Contraindications. The drug label advises that hydroxychloroquine should not be prescribed to individuals with known hypersensitivity to 4-aminoquinoline compounds. There are a range of other contraindications and caution is required if patients have certain heart conditions, diabetes or psoriasis. Section: Overdose. Serious symptoms of overdose generally occur within an hour of ingestion. These symptoms may include sleepiness, vision changes, seizures, stopping of breathing, and heart problems such as ventricular fibrillation and low blood pressure. Loss of vision may be permanent. Low blood potassium, to levels of 1 to 2 mmol/L, may also occur. Chloroquine has a risk of death in overdose in adults of about 20%, while hydroxychloroquine is estimated to be 2 or 3-fold less toxic. While overdoses of hydroxychloroquine have historically been uncommon, one report documented 3 deaths out of 8 cases. Treatment recommendations include early mechanical ventilation, cardiac monitoring, and activated charcoal. Intravenous fluids and vasopressors may be required, with epinephrine being the vasopressor of choice. Gastric lavage may also be used. Seizures may be treated with benzodiazepines. Intravenous potassium chloride may be required, however this may result in high blood potassium later in the course of the disease. Dialysis has not been found to be useful. Section: Society and Culture. Subsection: Cost. The wholesale cost in the developing world was about $4.65 per month as of 2015, when used for rheumatoid arthritis or lupus. In the United States, the wholesale cost of a month of treatment is about $25 as of 2020. In the United Kingdom, this dose costs the National Health Service about £5.15. Subsection: Brand names. It is frequently sold as a sulfate salt known as hydroxychloroquine sulfate. 200 mg of the sulfate salt is equal to 155 mg of the base. Brand names of hydroxychloroquine include Plaquenil, Hydroquin, Axmal, Dolquine, Quensel, Quinoric. Subsection: Regulatory approval. On 17 March 2020, the AIFA Scientific Technical Commission of the Italian Medicines Agency expressed a favorable opinion on including the off-label use of chloroquine and hydroxychloroquine for the treatment of COVID-19. In the U.S., several state pharmacy boards reported that some doctors and dentists were writing prescriptions for hydroxychloroquine and a related drug, chloroquine, to themselves, family members, and staff. Sudden demand spikes caused by hospital use for severely ill COVID-19 patients and prescriptions for prophylaxis have resulted in shortages. Doctors have expressed concern that patients who have long taken hydroxychloroquine for other approved indications, like lupus and rheumatoid arthritis, will be unable to procure needed medicine. On 28 March 2020, the U.S. Food and Drug Administration issued an emergency use authorization to allow hydroxychloroquine sulfate and chloroquine phosphate products donated to the Strategic National Stockpile to be distributed and used for certain people who are hospitalized with COVID-19. In anticipation of product shortages, the FDA issued product-specific guidance for chloroquine phosphate and for hydroxychloroquine sulfate for generic drug manufacturers. Section: Pharmacology. Subsection: Pharmacokinetics. Hydroxychloroquine has similar pharmacokinetics to chloroquine, with rapid gastrointestinal absorption and elimination by the kidneys. Subsection: Mechanism of action. Hydroxychloroquine increases lysosomal pH in antigen-presenting cells. In inflammatory conditions, it blocks Toll-like receptors on plasmacytoid dendritic cells. Toll-like receptor 9, which recognizes DNA-containing immune complexes, leads to the production of interferon and causes the dendritic cells to mature and present antigen to T cells. Hydroxychloroquine, by decreasing TLR signaling, reduces the activation of dendritic cells and the inflammatory process. In 2003, a novel mechanism was described wherein hydroxychloroquine inhibits stimulation of the Toll-like receptor 9 family receptors. TLRs are cellular receptors for microbial products that induce inflammatory responses through activation of the innate immune system. As with other quinoline antimalarial drugs, the antimalarial mechanism of action of quinine has not been fully resolved. The most accepted model is based on hydroxychloroquine and involves the inhibition of hemazoan biocrystallization, which facilitates the aggregation of cytotoxic heme. Free cytotoxic heme accumulates in the parasites, causing death. This concludes our discussion on hydroxychloroquine. Please like, comment and subscribe to help support our efforts.